we're faced, between a rock and a hard place. It's very hard to figure out what to do for a lot of our governments, where over 70% in many countries of our population, of our economic system, of our labor force is informal. We know that in the absence of a vaccine, what we have is social engineering in the form of social physical distancing. I call it physical distancing and not social distancing. But in the absence of a vaccine, that's all we have. Faced with an economy structure and a labor structure that we have, it's almost impossible to copy and paste lockdowns in the way the rest of the world is doing. Buki gave really great examples of what this means for women. And you can see our government struggling to figure out how to balance these things. I'd like to point out the things that we're seeing now are really structural failures and historical failures. And somebody said, we can't go back to normal because normal is the problem. And this really brings to the fore where all this, and for us on the continent, where the cruelty really of neoliberalism plays its part and is really stripping down health systems, stripping down public services and goods, both in terms of resources, but also in terms of perception. And I think there's something to be said around the politics of perception and of narratives, where public services and goods have been so stripped away by a capitalist and neoliberal approach that pushes the idea of privatization, with the World Bank and the IFIs now pushing for PPPs, for example, and this notion that private is better than public. And what does that do for a government where we're in a state of crisis at the moment, and we need our leadership to stand up and guide us through this? But there's a constant sort of doubt in what they are able to do because it's public, and that social contract between state and citizen has been so stripped down by all this, the neoliberal agenda. We've also seen weakening of systems through donor funding, for example, where there's a lot of vertical approaches. This focus on malaria, this focus on HIV and AIDS, rather than looking at systems holistically, where intersections of GBV, of SRHR issues, of economics, of access to public services and goods like water, of public goods all over, that's stripped down into very insular, sort of very specific issues. That means it's harder to fight a pandemic like this. But also met with our governance structures and our history of colonialism. And you can see there's been comparisons made of British colonies having the very same violence meted out on their populations. We, at the very beginning of our it's not a lockdown that we have in Kenya, but more of a curfew from 7 p.m. to 5 a.m. At the beginning, we had more deaths from violent police action on citizens than we did actually have from the pandemic. So it brings into question this policing state and how we're going to roll back on that, as well as the surveillance of our people and what that means moving forward. So we do know that the pandemic will disrupt our economy. We know that. There's an interesting issue that comes up that speaks to the mobility of Africans, because currently on the continent, there's a perception that the virus is a wealthy virus. It's one for people who are able to travel overseas, who fly. And there's a good example in Kenya. They're shutting down golf clubs, and they say, well, you can play your golf, just the caddies can't come because, golf players there's a risk that the golf players might transmit it to the caddies. And this changes a perception where infectious diseases on the continent have usually moved from more informal settlements and poorer populations rather than the reverse. And this also talks about an inequality of travel and access to travel and what that means in a global perspective. I think we also have to bring to the fore that this is also moving countries to be more nationalist about their approach to both the economy and public health care, and what it means for multilateralism, where we know that a lot of our problems have global solutions. And so where can we begin to reignite a different kind of multilateralism, where we begin to look at things like healthcare as a global public good, I think is an important area to look at. And we can see that being stripped away very rapidly in these times. But I'd like to also talk about how Africa has community social capital. With the stripping away that I spoke about of the social contract, it means that citizens are very many a time left to their own devices and left to self-coordinate, self-mobilize. And that might come in useful at this point where we're able to mobilize at community levels, exactly what Buki talked about. How can we make sure that we're doing that in a structured way? And I think we have a history of doing that, and that might come in useful. We also have to remember that government revenue is falling. Governments across the continent are looking to, give people tax rebates, right? But then also how many people are in the tax bracket is a question that is brought up. But even those that are, it means that government is reducing their revenue at a time when they so badly need the revenue. So what a number of people, both civil society and government, as well as institutions, are calling for is as debt moratoriums. And Ramaphosa has been at the front of this call as a chair of the African Union and has began leading this process, and is one that needs to have all African countries come together to do. Getting African countries has been a problem, coming together, but I think these are unusual times for us, and it's something that will have to be done to be able to ensure that we have the money, because we have borrowed debt. We're not going to be developing any infrastructure, building bridges or anything. And so rather than looking for more debt for countries and economies that are so overburdened in debt in the first place, we need to be calling for a moratorium on debt and redirecting the money that we already have towards ensuring that we're able to spend in the right places and at the right time. So the World Bank also forecasts that the sub-Saharan region, our economic growth for 2020 will drastically contract. Sub-Saharan Africa will lose $37 to $79 billion in output losses due to trade and value chain disruptions, amongst other factors. And so we need to begin to look at what happens after this, what happens to our populations, our economies, what happens in a world that is so integrated in terms of economy, but also public policy. Where does that leave us? We also need to remember that in as much as this is a global pandemic, we have a whole lot of other things going on. East Africa has seen the worst locust invasion in a long time, and they're predicting the next phase is coming in. That ties in with food availability and what that means for a country that's economies are really on their knees. How are they going to be providing food to people? When we're talking about cash transfers and food packages, where does the money come from is the biggest question. How do we feed people when we're asking to lock them down in spaces that are unsafe, but also where they can't access food in the face of locust invasion, for example, in East Africa, I think is a huge problem. And speaking to this, Gary spoke about the importance of data disaggregation, and for us on the continent, that has many layers, both by sex, by geographical location, by ethnicity, by religion. There's so many economic quintile. It means that whatever targeted approaches that we have will be determined by the state, and we need to begin to start collecting it from the African continent, because we've had to leapfrog a number of things. We've had to leave, so we've used technology a lot. Buki spoke about this, and there's a lot of initiatives happening that are getting citizen data, public data in collating it in disaggregated ways. And so I think that's important. It's not perfect, like Buki said, but I think it's important to have. There's a little bit of hope in terms of Africa has been the manufacturing floor of very many things. And so for Kenya, for example, we're now producing our own masks, our own PPE kits at a lower cost than we're able to import them. And that might mean that we are able to then maybe, if we have surplus, plug in the gaps in the global value chains. It's also important to note that a lot of these manufacturing floors are actually manned by women. And it's also then making sure that there's an intersection of making sure that their working conditions are safe and there's childcare provided for this, which again takes resources of which we don't have. But also in an interesting turn of events, our doctors are used to working with almost nothing. They're used to developing things out of nothing. Today, I saw there's some doctors who are developing how to break ventilators into 3 ventilators from 1, and so these are things they're used to having to innovate on the spot in ways that global northern medical spaces are not used to, because they have the luxury of abundance. Usually it's something that we don't have. And I think that's something that we have to remember. And so I'll stop with a quote from a lady called Shefa Okore, who's Kenyan and is on the front line of the civil society movement. And she says, this virus is showing us that everything, and I mean everything we're forced to believe is impossible within our borders, is actually possible. We can do things and do things very well. We can reimagine behavior. We can be led by courageous people, and we can depend on really just us. And I think that's a powerful, hopeful thing to say. We know that we are not anywhere close to the peak of this on the continent. As Buki said, we don't even know how many cases we have. Our testing levels are really low. But I think we have the experience of working with very infectious diseases on the continent. The African CDC is doing a lot of work to make sure that their coordinating approach. Our resources is a huge problem still, but also it means that there's space for us to reimagine a different macroeconomic policy and landscape globally, and one for the continent, but also one for our nations individually. And I think that's important as a way forward. Is it presents a space for us to do something differently that is so badly needed.